Hello guys, in this video we are going to study about the symptomatology of various systems. In the previous video we did study about the ODPAR component of the HOPI. So this is going to be a very short video, and I urge you to not take any screenshot because we have a prepared note for each of the video in the description box, free to download. So let us begin. First, the symptomatology of cardiovascular system. The general features that a pediatric patient might present with are dyspnea, chest pain, palpitations, cough, edema, and features which are specific to the rheumatic fever are the ones which we include in Jones criteria, that are carditis. So, clinical evidence of carditis is what I mean. Arthralgia, arthritis, subcutaneous nodules, sydenhams, chorea. So, chorea is basically because of the lesions in the basal ganglia. These are distal involuntary movements of limbs, and we have erythema marginatum. Rheumatic fever patient do present with features of heart failure. It can be features of left-sided failure or features of right-sided failure. Now, patient having cyanotic heart disease, they might present with cyanosis, cyanotic spells, which we also call as stat spells, and squatting. These cyanotic spells relieved on squatting. So, in the upcoming video, we will study in detail about cyanotic heart disease in the form of case. We have studied about the symptomatology of cardiovascular system. Let us study about the symptomatology of respiratory system. So, respiratory system, we have these features: cough, breathlessness, hemoptysis, chest pain, and grunting. Some of these features we did see in cardiovascular system too. So, how do we differentiate whether this symptoms is because of the respiratory problem or is it because of the cardiovascular problem? So, it this is the whole point of HOPI. You study the progression of the disease, the aggravating and relieving factor, and on the basis of all of this component, you decide whether the cough belongs to the respiratory system or it belongs to the cardiovascular system. And the next we'll study about the gastrointestinal system. If we were studying medicine right now, I would have told you there is a clear difference between the upper GI and lower GI tract, that is ligament of treats. But this is symptomatology. There is no clear cut difference between upper GI and lower GI tract. The upper GI symptoms are pain, loss of appetite, vomiting, melena, which is blackish tarry stool, and dysphagia. And lower GI symptoms are diarrhea, constipation, and hematochezia. Hematochezia is like fresh blood in the stool. Some liver disorders may produce symptoms like jaundice, pruritus, clay colored stool, and high colored urine. These two are basically features of obstructive jaundice. Pruritus is because of bile salt, and jaundice has prehepatic, hepatic, and posthepatic cause. The symptomatology of CNS include convulsions, mostly febrile convulsions in a child. Paralysis, it may be because of polio or Guillain-Barré syndrome. Focal neurological deficit is because of maybe space occupying lesion and altered sensory. The features specific to genitourinary system is burning micturition, facial puffiness, hematuria, and oliguria. In the upcoming videos, where we will discuss each of the important cases for your exam, we are going to study about nephritic and nephrotic syndrome, where we will discuss about this facial puffiness progression, the hematuria component, and other things. So this was all about this video. In the next video, we are going to study about past history. Thank you for watching this video. See you in the next one.